Question. I recognize the member for Don Valley East.
For the Premier, Madam Speaker. While this government lives large from the circular economy of skills development funding, filling donor and party coffers, it has posted the largest debt in our province's history with nothing to show for it. Housing's down, employment is down, and now healthcare is down. This Premier funds healthcare and hospitals at the lowest rate in Canada. In North York, a family health team and its healthcare workers have been pitted against each other because this Minister of Health and that Premier are too busy doling out SDF dollars to donors instead of funding healthcare properly.
Question.
Does the Premier think it's okay to give millions to his friends at bars and nightclubs while nurses and healthcare workers can't get paid fairly?
Minister of Health.
Speaker, it may be helpful for the members to understand when I went to Calgary to meet with the federal health minister and the provincial and territorial health ministers, they were actually looking to Ontario and say, how do you do it? How do you get over 70% of your patients that are connected with the primary care team? How are you able to expand in every single medical school new seats for young people to be able to train in our medical systems? How do you continue scope of practice changes that mean people have access to additional services through their pharmacy, through their midwife, through their nurse practitioner, through multidisciplinary teams where we have invested in $2.1 billion? They are looking at Ontario for that leadership to say, we see you can make it happen, we've seen it work, share that good practice, and let's do it across Ontario.
Back to the member for Don Valley East.
I'll finish the sentence for the minister in Calgary. They said, how do you do it? How do you sleep at night? This government feigns outrage at the injustices facing Ontario patients, even as it does nothing to address them. They say you'll always pay with your OHIP card, not your credit card. But when 50 patients were identified this summer who had been inappropriately, illegally charged extra fees for medically necessary care, the Minister of Health said she promised an investigation, but months later, nothing has happened. You know what this says to patients? Can't wait for surgery? That's okay. Let them pay for it. Can't find a family doctor? That's okay too. Let them find a pharmacist. Can't put food on the table? That's all right. Let them eat cake. Madam Speaker, the Minister of Labour has no problem reimbursing donors using skills development funds, even as Ontario patients can't get reimbursed for illegal
Member for
billing.
Niagara West will come to
Why
order.
is it that friends and donors get paid first in this province, while healthcare workers and patients always get paid last?
Minister of Health.
Why is it that the hospital sector in the province of Ontario has had on average $1 billion investment every single year for the last 3 years? Why? Because Premier Ford makes sure that we are protected in the province of Ontario. Why is it that we have more than 90% of Ontario residents connected with a primary care clinician? Well, that's because we've invested $2.1 billion in primary care in the province of Ontario. Why is it that we are celebrating a brand new medical school in the province of Ontario in the city of Brampton? Why? Because we've invested. We will continue to invest in our healthcare workers, in our hospitals, in our primary care system. I haven't even touched on long-term care. Why is it that we have now in long-term care in the province of Ontario 4 hours of direct patient care in the province of Ontario? Why do we have that? Because Premier Ford is investing in